Every lawyer has to tell you this, that what I'm going to share today is, from the perspective, I am a lawyer, I am not your lawyer. And the reason why we always have to say that we're not giving you legal advice is that I don't know all of the facts of what your situation is. Like, I don't know your state law, I don't know all the facts behind your data sharing agreements. So while what I'm sharing with you is hopefully educational and informative to you, please do not rely on it as legal advice, because that's not how I'm giving it. Okay. All right. So the way we approach this, the way I approached doing this overview or review to try and identify for people what are the common trends or themes that we're seeing in data sharing agreements that have been negotiated over the last, say, 2 years between states and tribes or states and tribal epicenters. The methodology that I used was I took 5 agreements that are between a tribe and a state, or a tribe and a tribal epidemiology center. And those 5 states were agreements entered into by Alaska, Arizona, Michigan, South Dakota, and Washington State. 2 of those agreements were between the state and tribes. 2 of those agreements were between the states and tribal epidemiology centers. And one of them was kind of its own beast, because Alaska has a really unique, Alaska's tribal health system has a really unique legal structure. So they're kind of like a tech plus, or tech on steroids. The way I defined what would be a key provision was if the language about the issue showed up in at least 3 of the 5 agreements. There were other terms, some provisions that didn't show up in at least 3 agreements. They didn't meet that definition, but they're worthy of note, and I'll be showing them on a screen a little bit later. So you can see in the box here the 8 key provisions, ranging from what type of agreement it was, what are the specific data provisions, what are some of the provisions that could make it a lasting agreement, whether there was state recognition of tribal data sovereignty principles, and the other ones that are listed there. I will talk very briefly about some standard provisions that appeared in all of the agreements that are kind of like more typical data sharing, regardless of who the parties are. And then also some hints at what future data sharing agreements might look like, or terms that they might have. So let's dig in. Okay, the types of agreements. There were, of the 5 agreements, 3 of them were data sharing agreements, and 1 of them was a data use agreement. The only difference between those 2 in title is that when it's a HIPAA covered entity that's entering into the agreement, it's generally got to be called a data use agreement. So those were 4 of the 5, and 1 of them was a memorandum of understanding. I always point out to folks that unless the memorandum of understanding is written differently than a typical one, generally an MOU is not legally enforceable. It may be an agreement, but it's not a legally enforceable contract or agreement. Of the 5 agreements, 3 of them were set up as like an umbrella agreement or a master agreement, some people would say, that dealt with the big picture issues that you have to have in any major kind of data sharing. And then they had separate appendices or addendum that were where the parties would negotiate the specific terms of related to like one database. So that was 3 of the 5 agreements. 2 of them were single straight up data sharing agreements. I want to mention that the data flow in these agreements, 3 of them were unilateral. Data was going from the state to the tribe or the tech, and in 2 of them there was bilateral data sharing. In 1 of them, it wasn't much data sharing, though. It was more like corrective data was going back to the state if the tech picked up on change of address or additional information about treatment, that sort of thing. But that was the gist of it, largely unilateral. Okay, so here, this slide is about a key provision is legal authorities being cited in the agreement. Now, why it matters citing legal authorities is because it anchors the parties' understanding in what provides a legal authority to share the data, right? Also, it serves as an education for those who have to abide the agreement but didn't negotiate it, especially those who come maybe years after the fact and they are they are implementing the agreement without having been a part of the original negotiations. Think about staff turnover and how that can impact things. Also, citing state law makes it very clear what the legal basis is for sharing or for not sharing certain data. I was going to say, if you have other reasons why you think citing legal authorities in a data sharing agreement of this nature is helpful, please throw it in the chat and inform the rest of us your thoughts on that. So looking at the slide, in 3 of the agreements, the tribe's inherent sovereign power as a public health authority was referenced or cited. In those same 3 agreements, the tribe's status as a public health authority under HIPAA was referenced. Interestingly, the 2 agreements with TECs did not cite the TEC status as a public health authority under HIPAA. In one of the agreements, there was a reference to the TEC's public health powers. I think that was Alaska, because it's that quasi or a tech plus situation. But as I said, in the 2 agreements the other 2 agreements with the TECs, they neither cited the TEC's public health status under HIPAA nor the federal legislation that gave TECs their powers. So there we go. And in 3 of the cases, there were state laws, some state laws governing the release of the data of the tribe were cited. Okay, so next slide. Oh, here we go. A few other little tidbits there. My apologies, there's a lot on this slide. Yes, Megan, I hear you. But there's a lot to tell you about with the data provisions and the key provisions that kind of rose up to the top. These are, after all, data sharing agreements. So there are several listed there on the left. So the scope of the data that can be released by the state, in 2 of the agreements, all public health data potentially could be released to the tribe. State law may require some of it to be de-identified, was the restriction there. In 2 of the cases, there were certain limited listed, databases specifically were allowed to be shared. The agreement didn't go beyond that. And in one of the agreements, it wasn't specified what data could be shared because that's negotiated in the appendices of the agreement. Another question was, are the data elements identified? In 3 of the agreements, they're not specified, but they are detailed. They are planned to be or are already detailed in those separate appendices. One of the agreements talked about the data being jointly owned by the state and the tribe, so presumably you don't have to talk about data elements. And in one agreement, data elements were not specified. A key factor, a key provision that often is discussed is whether or not the data that gets released is limited to the data of tribal members. Yeah. Oh, sorry, I heard some background noise.
Apologies, sorry about that.
Okay, so in releasing the data limited to tribal members, in 4 of the agreements, no, it's actually not limited to tribal members. Although one of the agreements between a state and a TEC does require that the data of any non-tribal members or tribal American Indian, non-American Indian Alaska Natives who do not live in the tribal lands, that does have to be de-identified if that's going to be shared. There was one example of one of the agreements where the data is limited to persons identifying as having tribal affiliation or to people residing on the lands overseen by tribes, family members, whoever else is there. So I wanted to point that. I found that interesting that in 4 of them, the data was not limited to tribal members. I'm guessing that 3 years ago, that would have been a very different result. There's been quite significant change since then. Permitted uses and disclosure language. I would describe it as whether it was broad or narrow. In 4 of the cases, for the agreements, it was fairly broad, what the permitted uses and disclosures of the language of the data would be, and 1 it was narrow. The last point on this slide is about line level data versus de-identified data. If we think about data as on a spectrum in terms of identification, there's individual line level, sometimes protected health information, fully identifiable data, and then it kind of goes all the way to the other end of the spectrum, which is de-identified data, sometimes aggregated or aggregated data, sometimes de-identified completely, sometimes not. In 4 of the agreements, any data up to and including protected health information may be disclosed and covered under this data sharing agreement, depending on applicable state law. So state law may curtail it. The data can be shared, but it has to be de-identified. That was in 4 agreements. Again, that doesn't necessarily, that state law may or may not apply. But the point being that 4 of the agreements said that any data up to and including the most highly identifiable may be shared depending on applicable state law. And in one agreement, again, it's not in the agreement because it's something they negotiate in the appendix. Okay, next slide. Okay, so a couple of things kind of rose up when I was looking at all these agreements. And one of the things I thought about was, well, a key provision is whether or not this agreement is going to be a lasting agreement, because we all know how much time and energy and legal resources go into, and staff time go into negotiating data sharing agreements. So if they can be negotiated and have a longer life to them, it would seem that that is a benefit, right? So there were 3 different things that I looked at, provisions that in my mind kind of went towards the idea of a lasting agreement. So the length of the agreement and the ease of renewal. One of the agreements is a so-called evergreen agreement, which means that there is no deadline to it. There is no end to it, no termination date. There are a couple of grounds that the agreement can be terminated under, which I'll talk about in a second, but there's no end to the agreement itself. In 3 of the agreements, they were 5-year agreements with the opportunity for the parties to come together and renegotiate or extend it if they want to. One of those 5-year agreements said you can only renew it for another 5 years, and then the agreement would be gone. And then there was one 3-year agreement. Again, parties can agree to come together and renew it if they want to. Now, as far as the grounds for termination, the fewer the grounds, the longer likelihood, the longer the likelihood of this agreement going on for a while, potentially. In 3 of the agreements, either party can terminate for any reason, which I saw as kind of cuts against the idea of this. We don't have to come back together again and go through all of this again. But that's what the parties negotiated. That must work for them. In one of the cases, either party can terminate, but only if there's a breach of material term on the agreement, or if there's a change in law that affects how the parties have responsibilities under the law. And in one example, the state and only the state can terminate the agreement without cause, or if the tribe defaults on the agreement. And I wanted to mention that one or bring that to the attention because I did think that while that may be something the state and the tribe may have wanted or negotiated, there's definitely a lack of parity to that, a lack of power in that, just worth pointing out. And then the last thing about, lasting agreement here is the process of resolving issues in the agreement. There were 4 agreements that did navigate that or did include language about that people would be able to come together and try and resolve any issues, as opposed to just straight going to arbitration or terminating the agreement. And I saw that as kind of a key pillar to these agreements, there being a certain amount of trust and commitment to the agreement from the parties. Okay, another key provision is the idea of does a state recognize the data sovereignty principle? And there were a couple of ways that I saw that coming up through the agreements. One was whether the state has a tribal data sharing policy, like a formal written tribal data sharing policy. In the case of 2 of the states, Alaska and Washington, they have such written data sharing policies. In the case of Arizona, Michigan, and South Dakota, they were not stated or referenced in the agreements. And I just didn't know independently if that was the case. If anybody here happens to know that any of those states does have a written tribal data sharing policy, please share that in the chat and raise all of our levels of awareness about that. And that having a policy is one indicia of the state's recognition of tribal data sovereignty, right? Another indicator of that is addressing the issue of data ownership. I will say that it was remarkable to me that even one of the agreements, and in this case, only one of the agreements, has that language, even covering or looking at the issue of data ownership, because while that is a foundational principle in tribal data sovereignty, that the tribe owns the data of its people. There's no consensus among state public health authorities that tribes own the data of their tribal members. So I'm not saying that's good or that's bad. It's just there's no consensus on that side of it. And also many state laws governing state use and disclosure of data do not currently reflect tribal data sovereignty principles. So I think this question of data ownership and getting greater cohesion and understanding of it is one of those future indicators of, or an indicator of what future data sharing agreements might look like. Okay, transmission methods. This is about how the data is accessed by the tribe or the TEC. In the case of two of the agreements, the tribe or the TEC actually has direct access to the state's data system. They can access that data directly and pull it down for themselves. In 4 of the agreements, the state sends the data to the tribe or the TEC. Yeah, and the reason why that adds up to not 5 is because they're not mutually exclusive. Within an agreement, a state and a tribe could have agreed that, okay, for these databases, there can be direct access. For these, the state will send the data, or it could be on a, as the interoperability is increasing and they're growing what data is being shared, it may shift away from the state sending data to more, direct data access. Okay. Another key provision was security requirements and compliance with the security requirements. So by way of a little bit of background, states that are disclosing, or in the terms of disclosing is the legal term typically, or releasing data, are often obligated by state law, even if HIPAA doesn't apply to them, are often obligated by state law to require whoever is getting that data has to abide certain security provisions, certain security protocols. And the state's compliance with those laws relies on getting those requirements into the data sharing agreements that they negotiate. So in the case of 4 of the agreements, they do have language on the conditions and requirements for securely handling the data, that they're detailed, including language about the people who are authorized to access the released data on the receiving end, on the tribe, with the tribe or with the TEC, or in the case of the bilateral agreements, on the state side also. And that's why I said that there are 4 agreements that included that language, and 2 of them say that those requirements apply to both parties. Now, one agreement, which is why you don't see 5 on here, it's actually between 2 HIPAA-covered entities. And because HIPAA prescribes what administrative, physical, and technical safeguards have to be in place in order for the health data that's covered by HIPAA to be shared, there's no need to repeat it in the data sharing agreement, as long as there's like a reference to the, the sections of HIPAA that do apply and must be abided by. Okay. All right. The last section, or the last key provision that I noticed showing up in 3 of the agreements was the concept of advance notice being required before any publication using the data that's been received or the data that's owned is made. And there were 3 agreements that address that issue. One of the agreements states that the state must obtain permission from the tribe prior to doing any publication of data. And the reason why I listed that one first is because for many people in this audience, I'm sure that's news, the concept that the state has to get permission from the tribe. So I wanted to point out that that was reflected. Again, that's a key data sovereignty principle reflected in one of the agreements. Now, in the case of 2 of the other agreements, the tribe or the TEC must share with the state in advance whatever its analysis is or whatever it's planning on publicizing, where they've used the data that they've received. Okay, very quickly now going through this. There are the standard agreement provisions that these are not limited to just agreements between, public health authorities, state, tribe, TEC. But I bring them up because they can be really helpful to clarify whether existing data sharing agreements remain in effect or whether there are any other writings floating around that could be seen as part of the agreement. It's really all about clarity. And I think all of the agreements had various language on this. One was addressing whether or not this new agreement replaces all prior agreements or not. Another was that, is this the entire agreement? In other words, cutting out any floating other concepts that may be out there that are in writing even, but are not part of this agreement. This agreement is what will rule. And then also pointing out that all changes must be in writing. And again, these are it's a good idea because, again, there's staff turnover, there's lawyer turnover. It's just a good idea to make sure that the parties really understand what the agreement is, what it's limited to, and it's this document here. Okay, just a couple minutes more. Having covered all the key provisions, I did note that there were terms of interest that really stood out to me as either being unique to the agreement or something I thought would be of interest and educational for this audience. One is that, and this is in the instance of the agreement between HIPAA-covered entities, the parties agreed that they would put into the agreement the statement that, or the acknowledging that the state can rely on the TEC or the tribe's representation, that any protected health information that they're requesting of the state meets the HIPAA minimum necessary standard. And why that was a big deal in that case, I can say, is because that then minimizes the amount of times that the parties have to negotiate about what minimum necessary is, because HIPAA does allow, and there's case law on this, HIPAA does allow the parties, a public health party, to rely on another public health party's representation that, yeah, this is the minimum we need, to do the work for the purpose of the public health work that we're trying to do with the data. I'll skip the next one, but I do think it gave weight to the agreement to have notice of the document, the mutual respect accorded to each other as public health professionals. I did also think that it was, not all agreements recognize that data sharing benefits the larger community, not just the American Indian, Alaska Native population. So I thought it was particularly strong that one of the agreements at least said the agreement is for the benefit of the tribe and all state residents, again, recognizing that public health is not limited by borders. The last two some data sharing agreements address and acknowledge tribal data sovereignty as a principle that's guiding the agreement, and it's the approach to collecting and sharing tribal data, which I think gives it greater weight, having that in the agreement. And that's why this last example here shows, well, I'll read it out. This is in regard to whether or not the party can basically check up on the other party to make sure that it's abiding, that it's protecting the data as they've agreed to. In the case of this one particular agreement between a state and a tribe, the language was limited to say that only if the state is mandated by statute or an audit does the tribe have to make itself available and its facilities accessible to the state to periodically monitor and evaluate whether compliance is happening with that data. And the reason why I bring that up, or the reason why I give that example, is I think it's a good way to show and make the point that this is a government to government relationship. This is not a government to nonprofit or a government to a social service agency relationship. This is a government to government relationship that has certain expectations of respect, right, of a sovereign immunity. Okay, let's see. I did, and one of the other speakers, one of the speakers who follows was involved in negotiating the agreement that I pulled these concepts from. So she may speak to it more directly in her presentation. But I thought it would be helpful to bring out some hints of what the future of state and public health, tribal public health data sharing might look like, because I think this agreement had some very, I don't know if advanced is the right word, but had terms that truly reflect in a way many others don't, the depth of tribal data sovereignty. So in one case, it's the the state needs to get permission prior to doing any research using the tribal data. Or another provision is that the state has to update all of its external data sharing agreement with others that touch tribal data, and add an addendum that includes the tribal data sovereignty principles to expand those principles beyond just the relationship between the state and the tribe in this case. Let's see, another one was that unless it's covered in the agreement or agreed to by the tribe, the state will not intentionally collect tribal membership, tribal affiliation, or tribe census tract identification in any health department database. Again, I offer these up as examples of probably the agreement that had, in my mind, the most depth around representing tribal data sovereignty concepts. Okay, my last slide here, I just wanted to list a few resources that you may be interested in reading. The second one that's in bold is a really good article that Dr. O'Connell, Megan, wrote with attorney Charlie Abarisk about, and it's got some of the really good legal basic foundational information about legal authority of TECs and tribes to have public health data, what that authority is based in, how they get it, federally recognized, whatever, federally granted or sovereign granted. So I wanted to share that with all. And with that, I will be done with my presentation and turn it over to Dr. Megan O'Connell. I will leave the slide up here for a second. This is Megan's illustrious background. And now, Megan, I think hopefully you can come back on the screen.
All right.
And speak.
Thank you. Thanks, Chris. Well, thanks for that update. Good afternoon. Good morning, everyone. My name is Megan O'Connell. I am the Chief Public Health Officer for the Great Plains Tribal Leaders Health Board, which houses the Great Plains Tribal Epidemiology Center. In case any of you aren't familiar, the Great Plains IHS area has 19 service units and 18 tribal communities on our board within the states of North Dakota, South Dakota, Nebraska, and Iowa. So we have 4 states to deal with jurisdictional issues. Some tribes are in multiple states, some tribes are land-based, some are not. So we do a lot of work in this area. Next slide. So I'm going to cover 3 main topics and explain a little bit about our data sharing agreement with South Dakota. So, but first thing to remember for everyone here, and especially our state and or federal partners, is that none of this works without tribal sovereignty. The only reason tribes have the ability to get this data, and as Chris mentioned at the end of her presentation, is that tribes are not kind of community organizations or nonprofits. They are sovereign nations, and that allows them to receive this public health information to protect the health of their people. In TECs, and I can only speak for, I'll just speak for our TEC and its structure. We're housed within the Great Plains Tribal Leaders Health Board, which is a consortium of all the federally recognized tribes in our area. So essentially we work for the tribes directly. They're my bosses. And so that is a way in which the tribes in our region have chosen to work together and it's a sovereign choice to do that and allow some of the work to be done collectively through things like the TEC. So when working with tribes, I think it's important for our partners to remember, and sometimes they have to be taught. We did do a lot of education and continue to do with our state and federal partners, what sovereignty means, why tribes are sovereign, and that is centered within all of this, which means every tribe has a voice, and they might want different things, but tribes get to have that voice, and they get to have it as nations. Next slide. My other main point is everything's different. As much as we'd like all these DOAs and DSAs to be the same, everything turns out to be a little bit different. If we're looking at states in our situation, again, we have 4 states. We have an agreement through the TEC with the state of South Dakota to receive data on behalf of our tribes. In South Dakota. In North Dakota, it has worked out a little differently. as well as in Nebraska and Iowa. So in one case, the state essentially has chosen to work with tribes individually, not necessarily what all the tribes want. In another state, we're kind of doing it all at the same time, collectively with the TEC and individually with a tribe or more. And so every state is a little bit different. And of course, every tribe is different, which means that's tribal sovereignty. Again, we follow the lead of our tribes. If they want us to work on their behalf, we do that. If they don't, we don't. We don't jump into it. But trying to keep all of that straight, I think, is something if for everybody out there that works for a tribe or a TEC or in this space, we're probably used to, but it's not necessarily something that states are used to doing. Not all states. Some states are better than others. Next slide. So, and the other main point I want to get across about these agreements are this information is extremely important, but you need it before you need it, right? And we have in these negotiations, that's been a sticking point for us in terms of I call it a chicken and an egg problem. The state often wants to see programs that require health data up and running before we have the public health data to do them. And we were able to overcome that with the state of South Dakota, which is great. But all this information is needed before an outbreak occurs, before the next pandemic, before somebody needs to be found. And we were fortunate to enter into agreement with South Dakota, just as my example here, and in 2024. However, we had a syphilis outbreak for 2 to 3 years before that, and we had been mounting a large syphilis response since 2022 in the Great Plains. And so we were able to experience in the same outbreak response effort the difference between having data and not having data. Once we were able to receive data from South Dakota in 24, we were able to actually send people out, send our team out. We were working with federal partners and tribes to find people and bring them in for syphilis treatment. So you need that line level data, which is one great thing about our agreement with South Dakota is it's line level. It's basically real time, and we get all race data for anyone living on basically within a reservation boundary, and all data on AIAN people that don't live within a reservation. There are some limitations there, of course. Not everybody, that's not all the data I would want because you can't necessarily respond to outbreaks, especially outside reservation boundaries, if you don't have all the information you need. And then we also only get data related to infectious disease in the agreement, and that's more really a function of how the state has divided up their data. We only get infectious disease data. So if we're looking at measles, for example, we might know someone has measles and we may or may not be able to tell if they're immunized, right? Because we don't have immunization data. And that can be a frustrating component of this because as a tribe or a TEC, you may have to go and negotiate agreements for every little data silo that the state has created over time, even if you need all of it to do your work. So next slide, Chris. So again, my 3 thoughts here in my 7 minutes, I took 7 minutes, but tribal sovereignty is essential. No two things are alike, and tribes need what they need before they need it. These agreements are extremely powerful and can be really, really useful once they're in place, but they can be extremely frustrating and way too slow to put into place to make sure that tribes have the information that they need to provide important public health services to their communities. So happy to answer any questions. There's my contact information too. So thank you so much.
I don't know if you can hear me. Oh, yes, you can hear me. Okay. So our next speaker is Summer Hammonds. She is with the Tulalip Tribes and sharing the geography with Washington State. And she's now going to be speaking about her experience negotiating an agreement between the state of Washington and Tulalip. Please, Summer.
Good afternoon, everybody. Again, my name is Summer Hammonds. My Indian name is Lahus. That's a ninth generation name of my sixth great grandmother from the 1800s. I'm really excited to be here, and I know I only have like up to 7 minutes, so we're just going to get started. And of course, any questions we could save for the end too, and we'll be happy to get you the resources needed. So next slide, please. I just wanted to talk how we got here. I work for the Treaty Rights and Governmental Affairs Department for Tulalip Tribes, and our um, our positions here are really unique, and our department worked on intellectual property. And so, three of us from our department would go to Switzerland to actually negotiate live treaties. And intellectual property is important to tribes, to indigenous people, and so that really opened my eyes on data. And so, in our department, we hosted that, helping to Layla with language on all areas of data. And throughout the COVID outbreak, it was really hard for us here on our tribe. We had our our public health administrator really give us updates all the time. It was a nerve-wracking time, and especially for our elders. So we noticed too, working, with the state and the tribes, that COVID was a time that was highlighted for tribal health data. So that really sparked a lot of tribes in conversation. And one thing that's great is that American Indian Health Commission, they're online too. So props to them. They could send out some resources. They spent about 3 years negotiating a tribal DSA for tribes. And so what happened was DOH had a consultation, and that was closed, and the American Indian Health Commission came up with up to the 38th version, on behalf of tribes. And during that time, we didn't want that work to go away. And our tribe has a robust health system, and so we wanted to have access to data. So Tulalip took that initiative to meet with the state, and we spent about 6 months with the state going through their data sharing agreement, which had certain provisions provided by AIHC's negotiations. But it really took about 6 months to really try to understand from a tribe's perspective how this is all going to work. And I would say about after that 6 months, our team really got expanded with Amanda. She's on the line now. She's a senior tribal epidemiologist. Kristen Peterson, she's the chief of policy for DOH. And then we all sat at the table. I wanted to give props to our consultant, Byron Larson. He worked previously for Tulalip Tribes, so he knew how we felt on certain initiatives. So we spent about another year negotiating with Department of Health, and I really want to give props to Candace Wilson because she works for DOH, and she works with Tribal Public Health and Relations, and she has a strong sense of sovereignty, so she could expand on our concerns on sovereignty and how we wanted to relate that through our data sharing agreement. Another thing I wanted to mention is Washington. Our tribes are forward thinkers, and we get together all the time. And one of the ways that we do that is through the Governor's Indian Health Advisory Council, which I sit on as well. And so do 28 other federally recognized tribes, along with a few legislators, American Indian Health Commission. So we created a data subcommittee that was parallel to us already negotiating our tribal data agreement. And then one thing I did notice in the agreement is that we really wanted tribal data principles. And they weren't in the agreement. And so parallel with Governor's Indian Health Advisory Committee, there was numerous discussions about that, and American Indian Health Commission brought forward a data sovereignty principle checklist, and our tribes led the path of, adopting those principles. So that came out perfect timing because I worked with Amanda and Kristen from DOH to really get those throughout the DSA, that we were not going to finalize our DSA without those principles. And we really wanted to be intentional and have that work shine through. So we signed our data sharing agreement January 9th, 2025. We were the first tribe in Washington State to do that. And I'm really proud of our work and our collaboration. So yes, I want to give props to DOH, that's online, and then American Indian Health Commission, who else is online. So there are certain benefits to the tribal data sharing agreement. It leverages public health resources through the sharing of public health data across multiple jurisdictions. It increases a government's capacity to respond to a public health emergency. It reduces the cost of public health response, and it improves the overall effectiveness and efficiency of public health response. Next slide. We're going to talk a little bit about this, but I know it was talked about prior, but Amanda is online too, and I just want to give her so much gratitude because it was within a year. What we did was we had policy people at the table. Amanda's background is epidemiology plus policy. Kristen and Candace's were policy. My background is policy. So it's policy, we know how to create those fixes. And nothing is perfect in a DSA because you have to think about the future. So we were able to create language, which we met once a week for over a year and a half, and we were able to identify that important language in addition to the versions that were already established through a template. So we had broad framework, and because we know that the state has to improve their IT structure. And there's more examples through. I know that I will talk more about them coming up. But we wanted to create a proxy for how Tulalip data would be identified in all DOH data sets. And we wanted to require DOH staff to have tribal data sovereignty information and how to utilize that in the state system. We also wanted to make sure that there was consent on the data use. So we created the data form process where DOH helps fill that form out, and there's requests for consent from Tulalip, and especially with any third parties. So I wanted to really quickly just talk about the 8 principles of data sovereignty. And I know that IHC can upload that into the chat box. But 1, it's inherent tribal authority to manage our own data. 2, our ownership of and authority over tribal data as tribes. 3 is informed consent. We want to consent to what is going on with all the data in Washington State. And how can we do that? We have to have those build outs. Equitable access to data is very important, and equal partners in data projects. Consulting and engaging with tribes on the use of data. The privacy and security protections are important, and tribal data sovereignty supersedes third-party access and use to tribal data. Next slide. Now, when you're building with a state, it's not going to be perfect. So we did not provide, or there wasn't statewide access to WDRS, and because we need to have a build out on how the state carries our information in the system. So LSJ, local health jurisdictions, Snohomish County, we wanted to start out in the beginning with similar to that. So that's how we had our build out. We took a phased approach, data set by data set approach. So we want to be thorough with our build outs with the state. So we'll talk a little bit more about that approach. One thing that was really important is that we didn't want to put the state into as a middleman. So what happened was that DOH was not going to negotiate between tribes and TECs. So I have set Sunny Stone on here. I just want to give a quick shout out to her from Northwest Portland Area Indian Health Board. She understands data sovereignty principles, and we also are entering into an agreement with them as an epidemiology center for consent and, you know, the acknowledgement of accessing our data as a tribe. So can you go to the next slide, please? So currently, we're working with DOH every 2 weeks. We're currently accessing WDRS. Our future data sets are added through implementation. So we chat with them as our public health, you know, department is working with DOH on these build outs. Currently, we have comparative tribal, non-tribal information where legally permitted. And we're, you know, it goes back to that inherent right as a public health jurisdiction and as public health authority. And so we build out other data sets, you know, in a stage approach. So we're working on the consent approval process now, and we have a form process to approve use of Tulalip Tribes data by DOH. And we really work collectively with the state Department of Health. So I want to give them props. Next slide. The lessons learned is that you really have to have really good relationships or have those good relationships with those that you're working with collaboratively. And there is this part where we need to educate both sides, whether it's us educating the state or us educating the TECs, how we see that we want our data managed. We engage legal, IT, and public health early. We built out for expansion. We know that the solutions now might not be the solutions for later. So that was one thing that we had to recognize. So our work is not perfect, but rather forward thinking. And we know that we can always update the data sharing agreement as we get into future work. One thing that was important to us as a tribe is that we want tribal input from tribes matter, that their input matters statewide. So the Governor's Indian Health Advisory Committee is a great place that we wanted to remain consistent with all tribes' policy interpretations. Therefore, the work of GHAC was so important. Next slide. So looking ahead, we're going to continue expanding our data sets. We're going to continue strengthening public health planning, and we're going to support data-informed tribal decision-making processes. And the last slide is, can you go to the next slide, please? This is a reference slide too. I just wanted to share that we just got done, the American Indian Health Commission, Tulalip Tribes, DOH, and the Pew Charitable Trust. We just published an article, and it's on the bottom of the references, so maybe that could be shared in the group chat. But it's really good to reference your work, create articles as you're also doing it. So what that does is it educates states, it educates epicenters, and vice versa. So on how we continue to move the work forward. So yeah, that's the end of my 7 minutes.
Yep. Okay. Thank you, Summer. Now moving on to Darian Fuller. Darian, can you speak now? Darian is representing the state of Arizona and can speak to the highlights and the process that they went through and what was learned from the process or about the agreement Arizona has with, let's see, Arizona was with the tribe, not the tech. Please, Darian.
Yes, hello everybody. I'm Darian Fuller. I'm the Tribal Health Epidemiologist at ADHS. I've been in my position a little over a year now. And during my time, I've been working very closely with Geraldine Hushkon, the Tribal Liaison for ADHS, and kind of getting familiar with some of our DSA processes. And so some things I wanted to highlight for our process specifically is that our DSAs, oh, it's just my face. Um, we worked to edit our regular DSA template to suit the needs of the tribes in the state of Arizona, which there are 22 federally recognized tribes. And part of those edits and accommodations include having longer terms for an active DSA so that it can kind of uh, work better with tribal election cycles and also workforce turnover. Um, and make it just makes it more convenient for the tribes to have longer active DSAs rather than trying to switch them every couple of years. We allow for specific edits of the DSA terms. We send them between our legal team and also the tribe's legal team. It's a back and forth conversation to get basically what everybody would like to get out of this DSA. We hold quarterly tribal consultations so that we are always talking and having a dialogue with the tribes, and they're able to tell us directly what they would like to see and what they are wanting us to do. In the time I've started at ADHS, we have edited the DSAs to be more inclusive of the data sets that ADHS has. So it's a bit more comprehensive. Unfortunately, that does mean it takes a bit longer to review internally and get approval and all of those steps. So time really is one of the things that is, it's never really on our side. This process, it does take several months to get approved and executed. So that is something to just be aware of. But with those data sets, they each have their own specific release timelines, and that is outlined in our DSAs, depending on which data set releases, how often they release, and the tribes, of course, are always allowed to request specific data in any time between that. As someone shared in the chat earlier, we do have an Indigenous data sovereignty policy that has been recently executed, I believe at the beginning of April. And part of that policy is to just really strengthen our understanding, our meaning the state's understanding of tribal sovereignty, tribal data sovereignty, and really emphasizing those practices responsibly. We're currently in the second phase of rolling out that policy, which is creating training modules and talks and presentations to internal staff and eventually to other members of the state and tribes. And since it got enacted, we will be revising our DSAs to include the policies recognizing those tribal data sovereignty principles, because currently there is no reference to it, but it was just recently passed, so it's not in quite yet. We I forgot to set my timer, so I actually don't know how much time I've spent.
Good. You're good.
I'm good. Okay. I was really hoping to stick with my 6 minutes or 7 minutes, you know. But I think, let's see, I covered all of the main topics I wanted. Some of the things that we are working on expanding, editing, adjusting, I would say maybe, is to kind of expand what it means to count among the tribal population in terms of if the tribe wants tribal data, they're really limited to the boundaries of their lands, and also if the patient is tribally affiliated, which sometimes that's not listed on records. So that's someone that is kind of lost to the system, I guess. So we're working on trying to reduce racial misclassification and get those records and those files where they need to be, and where where sort them out where they're supposed to go. And I believe that's all I have.
Great. Thank you, Darian. Thank you. That was helpful. It's always good to have a state's perspective as well as, the other folks who are speaking too. Thank you to all of our speakers. Megan, Summer, Darian. Sophie, if you can get the three of them, I guess, and me on the screen now, so we can all look at
Sure.
because now we're gonna have a little bit of a moderated discussion.
Sure.
Um,
I'll work on that.
So while you're doing that, I'm gonna pitch a question to Megan to start with. So get ready. Megan, with what you've just heard, Summer talking about the Washington Tulalip, and my apology for not pronouncing it correctly before, Tulalip Tribes agreement, and what Darian was just talking about with Arizona and its template agreement with tribes. And given the fact that you've been engaged in data sharing discussion and negotiation, and efforts to get more of it for, 5, 10 years, whatever it's been. With what you've heard and looking back over those years, what do you see signs of progress that have been made?
Well, I think so. I mean, I certainly have not been doing this as long as others, and there are so many people, and I'm sure many people on this call that have been working on this a lot longer than I have. But I came into this work during COVID, and I do think that was a moment, as Summer had mentioned, that really started to change things when there was a international emergency, health emergency, and it really was an all hands on deck situation. And tribes did some amazing and innovative things to protect their people with very limited information and a lot of times. And so I think that really helped move things, again, with advocates all over the country, including many people on this call today, to try to make sure that we're ready for the next pandemic or the next outbreak that will eventually come. So, people have been working on this for a long time, but I think that was a very clear example of why this is needed, why there's urgency to it, why data sharing needs to occur before the emergency occurs. And I think that helped. And states and federal agencies saw that, oh, tribes can do this stuff, right? Like, we knew that, but I'm not sure they knew that. And so you could point to, oh, well, tribes, this is what we're doing if we're a tribe, or as a tech, you can say, this is what the tribes in our area are doing. And it was just kind of proof of concept that this is needed. Tribes can do this work. They have the capacity and the will, and they're doing really great things. And so I think that was a great way to turn, kind of a crisis into an opportunity to move this forward.
Thank you. Darian, I have a question for you. One thing I'm wondering about is when you, and I don't recall if you were directly involved in negotiating the state's like template agreement that it now has, to use with tribes or not, but answer this however it feels, most informative for you. The wondering about, what do you see were the roughest issues, when the state was negotiating, the template agreement? Like, what were the sticky spots, I guess, from where the state may have wanted to go further but couldn't, maybe because of state law, or there were other pressures or whatever I'm just curious to know what were people might be interested in knowing what were the like sticky spots that you really had to work on to get it to come to the final version that you came to.
Yeah, so I was not directly involved with those negotiations. It was slightly before my time there. But just from what I can see and what I see now working with the DSAs currently, um, there are certain terms within the DSA that tribes I've noticed that there is more pushback on um, or requests for uh, edits in one specific area. Um, and I think also at the beginning, um, having access or providing the data, the tribes actually they don't have direct access to the databases. It's more the state shares the data from those databases. Um, the initial data sets were, I would say fairly limited, and I would consider them kind of basic, but now we have since expanded upon that. And when we say we're trying to get the tribes their data, we really want to give them all the data, that we possibly can. So I think in the beginning, we kind of had to be content with just, I don't want to say the bare minimum, but a starting point. A starting point was needed, and now it's gone further.
Thank you. Yeah, thank you. Summer, I have a question for you. Thinking that given your experience working very closely with a state, Department of Health to navigate all the various issues and come up with what I think most would say is a very strong, very complex, comprehensive data sharing agreement. What advice would you give for other state Department of Health representatives who may be on this call right now for how they might want to approach the tribes, who share a geographic region with them, for how to approach negotiating or starting to look at working together to get to a point of being able to share data? If you have any thoughts on that.
Representation matters. One thing that's unique about Washington State is we have our governor's office at Indian Affairs, and a lot of the tribal leaders work through there. And we also, at the majority of the top positions in Washington State, there is a director of tribal relations. Get your directors of tribal relations involved. Ensure that you connect with them on how to lead that work with tribes. Tribal consultation is important. DOH is really robust at always understanding that there has to be tribal consultation. So they work with the American Indian Health Commission, they work with the Governor's Indian Office of Indian Affairs, and there's a schedule of tribal consultation always. And so we built that out. A tribe could ask for consultation. That's why Tulalip, we had our own consultation with DOH. We maintain our work, over that last year and a half through a consultation process. So it's really about using your tribal representation, building that in your state. If tribes don't have that great relationship yet, write it into legislation, move forward, and educate state agencies on your viewpoints, and that mainly is through consultation. So I hope that really helps out.
Yeah, that's great. Not all, in my limited experience working with other states, not all states are obviously at that point yet of having an office of, tribal liaison. But those who do, that's a great person to pull in to have information on the state side, right? Okay, thank you all. In the interest of making sure that we've got time for Q&A from the audience, I want to go ahead and look at the Q&A right now and maybe start pitching some questions towards each of you. So give me one. You can be looking at the Q&A also. But let me go ahead and start. Some of them I may be able to answer like quickly if they're directed at, the survey that I did. All right, let's see. How detailed are the provisions stating when the state needs to seek permission for publishing? They were not very detailed. It was just kind of straightforward, like the state shall request permission before publishing. But if any of the speakers want to say more specifically on that, just gonna quick hit answers because I want to get to as many of these questions as we can. Anyone? Nope. Okay. Can you, let's see, can you restate findings regarding tribal ownership of data within these agreements? From memory, there was only one agreement that spoke to the issue of data ownership, and that was the one that Summer spoke to between the Tulalip Tribes and state of Washington. And it was, again, very straightforward. The data is owned jointly by the two. Yeah. Are there agreements that require or reference tribal council resolutions or other leadership support, like a letter from the governor? No, actually, none of the agreements went back behind the authority on its face of the tribe or the TEC. Maybe it's coming up in the context of a TEC. Megan, if you want to, I don't know if you want to address the issue, or it's kind of a quick answer of, from a data sharing agreement perspective, there does not need to be any tribal resolution reference there for the TEC to have authority of the tribes. That's between the TEC and the tribes, whether they're representing them. But Megan, do you want to speak more to that?
Yeah, I would agree with that. Not everyone will agree with me on that, but that is how we function. And to me, it is actually a sovereignty issue. If our tribes want a resolution for X, Y, and Z, they will require us to get it. If previous resolutions are sufficient, we have those. If a board resolution is sufficient, we have those because they're working collectively to pursue these different health activities and public health activities. So we generally follow their lead and push back on others' requirements as much as we can. If our tribes have said, no, we want you to do this, and we've authorized it in X way, we try to follow that lead and explain to an outside partner, no, they did it this way, instead of having the outside partner like a state say, no, they need to do it our way, right? So it's very common, right? we run into this all the time, and it's not consistent. It's different between states, it's different between agencies, it's different between people, it's different on different days, it's never consistent. But we again try to follow the lead of our board, which is our tribes.
Thanks. Okay, there's another question. And I think this could go, let me pitch it first to Darian, and then Summer, if you want to weigh in on this too. Someone's asking a question about, can you provide a definition of tribal data? So rather than giving the rest of their question, let me just put it to you, Darian, if you'd like to field it, or pitch it to Summer if you want. What was the definition of tribal data that you were working under in the data sharing agreement?
Our definition of tribal data is any data that is from a person that essentially that the tribe itself claims or is declared a citizen of. So we kind of leave that decision up to the tribes of who is considered a member of that tribe, a citizen of that nation. But by their definitions, then we consider what they consider tribal data. So it does differ amongst all of the tribes in Arizona.
Okay. Summer, do you want to
Yeah,
field that one?
this was a debate heavily with Tulalip in Washington State, because there was AIHC already negotiated the tribal data meaning. And then one thing that happened was it was updated and the language was changed. And we didn't like the proposed changes. So we worked really hard with DOH to ensure that we had the definition of tribal data, which means data or information that is specific to an individual tribe and includes public or private data or information on or about a tribe or its people subject to tribal rights of ownership and control. Tribal data also includes, but it's not limited to, tribe or membership or citizen, tribe or affiliation, events and conditions within the tribe's jurisdiction and lands, information about tribal members and any persons living within the tribe's jurisdiction, tribal census tract, tribal land, and identification of tribal facilities, entities, and enterprises.
Okay. Thank you both. There is such a variety, right, is really the answer. There's such a variety of how people define it, what they include in it. Megan, there's another question about, I'm actually going to skip this one because it's not really about the data sharing agreement, although it's a good one. The question about how do you avoid duplicated investigations or making sure cases don't slip through the cracks. Maybe you can follow up on that, in a different forum. But the next question I want to ask you is that this is from Ryan Martin. Given that many tribal citizens across healthcare outside tribal health systems, given how many tribal citizens access healthcare outside tribal health systems, how are tribal data sovereignty principles incorporated into public health data collection, sharing, analysis, and governance across non-tribal institutions?
They aren't, to my knowledge. I mean, it's the answer. They are. I mean, I don't know if anybody has a different answer, but they're not, right? I mean, for the most part, if you're in most of this country, if you go to your local hospital, they will report, say, infectious disease if I have measles to the state because they're under state law. I know that some tribal jurisdictions are working on collecting that data. So I'm speaking very broadly, but generally speaking, outside of those few specific cases, it's not a thing. And in our experience, tribal data, and my definition, which I'm not saying is the right one, is tribal data means data when a tribe wants it. And then all of these special ideas and powers are invoked and treated differently than if the exact same data is asked for by a non-tribal entity, like a researcher or a university or something like that. And so the protections are way past when the cat is out of the bag, right? And they're actually put into place when the data is trying to get back to the people and the nations that own it. And it's flying around everywhere else. And so there are not, in my experience, there's very few examples, and even in the ones I can think of, the data is still going to other entities. It's just also trying to be captured by tribes at the same time, where tribal data sovereignty principles are instituted basically at the first interaction with the health or public health system.
Yeah, thank you. All right, there's another question that Summer, I'm going to pitch this one to you because I have a feeling that with the depth of which you had to look at these issues in your agreement, you may be in a good position to, or you may have already, you as a collective may have already looked at this issue. The question is about how do you navigate data sovereignty and patient confidentiality? For example, speaking as the writer, we know that some tribal members seek care from the local health department because they want privacy, especially around sexually transmitted infection or HIV testing. Do you obtain informed consent for the data to be shared with the tribe? I think that's really meant.
Everybody needs to recognize that tribes have inherent rights via public health authority and that we have rights as a public health jurisdiction, and we should not be treated less than. We have the same capabilities as a public health authority to collect data, to analyze it, to interpret it. In our data sharing agreement, we wanted to be held accountable to the data that we're accessing. So we put provisions, in there for protection of the data, that DOH already has. So we have intense protections on that. Plus our health department that we have, it's a high security level. In the DSA, it covers the protections of that data, and that there's those expectations on how they have to manage it. And destroy, the information where applicable. So this is just an awakening for others to know that we're treated equally, if not more. And so tribes are taking that energy and moving it forward with sovereignty. And we do whatever is applicable by the data sharing agreement and the laws to protect that data. But we do have to analyze, and COVID was a good example. Plus, we have all these other infectious diseases coming through right now. So we're mindful and we're treated just as professionally, and we act just as professionally as those other local health jurisdictions or DOH. And I think that DOH did a really good job recognizing it and adding it into our data sharing agreement through that ability.
Darian, Megan, anything you want to add to that? Because I know that's it's a question that often gets brought up. The individual's confidentiality, particularly if they've taken extra steps to maintain confidentiality.
I guess I'll just add, I mean, I agree with what Summer said, but a similar example would be, I live in Iowa, but I go across the border to South Dakota to get tested for STIs. That information still goes back to Iowa. So it is part of the public health ecosystem. And if tribes are to be considered as, at the very least, equal public health jurisdictions in the terms of data exchange, tribes deserve that same exchange of information. And as an individual, I can understand why that's uncomfortable, but it's not tribal specific. That's how public health works in this country. So it actually, if someone has an issue with that exchange, it has nothing to do with tribes, right? That's public health data, and that's frankly a different conversation. But that's how the ecosystem works for anyone.
Yeah, I appreciate that, because I was trying to think about what's a parallel but reverse, and that's exactly the example that I came up with. So you're right, it's how our public health system works. So thank you both for that combo. Okay, one question that I see here is, and I think I'll field this one. How do you get data back to a tribe that may not have the capacity to safely store the data or no policy in place to guide them? So what I would say about that is, thinking of the review that I did of those 5 agreements, there was language in those agreements that says, the parties are binding themselves to the security provisions and, regulations, whether it has to abide the HIPAA security rule, if it's a HIPAA covered entity, or that's not relevant because HIPAA doesn't apply to the situation. But the parties have agreed to, in their agreement, that there will be certain security provisions and there will be an opportunity to, check up on is training happening on these issues. So I would say that the data does not go to a tribe that does not have the capacity to safely store the data or no policy in place to guide them, because if the state has obligations under state law or federal law to make sure that anyone it gives the data to is treating it securely, has security provisions in place and everything, then they can't enter into an agreement where they're not getting those assurances back, I guess you could say. So the data sharing agreement process is where those get worked out. But that's just my, lawyering thing. If anybody else wants to throw anything else in there on that, please have at it, or I'll go to the next question.
I can just add, that's why TECs exist, at least in our area, right? So we do, at the tribe's request, receive certain data because we have the capacity to house it and they don't. And that doesn't mean 10 years from now, they might, and then they want it back and we'll just hand it back over. But in the meantime, or potentially forever, whatever they want, that's one way, at least tribes in our region use the tribal epidemiology centers again as this collective. Okay, they can have, they can help with all the money. These things are very expensive, and the expertise that we as a tribe may not have, and we'll house our data with them. And depending on the data and agreements, and this goes beyond just state agreements, like we may house data we never look at. We just kind of keep it in the safe for a particular tribe, and then provide them a way to access that. So that's one like practical, technical way tribes that maybe don't have the data capacity, but maybe have contact tracers, can access that information if they don't have the ability or don't want to access the state system, as an example, directly. Use the text or a similar organization to that. I'm not sure what that'd be, but text.
Thank you for that, Megan. I'm going to ask one quick question of Summer that showed up. If you feel comfortable disclosing whether the data sharing agreement that Tulalip Tribes entered into with Washington had unilateral data exchange or bilateral data exchange, and I will set us up for the evaluation while you answer that. If you want to answer it. Did I lose everybody? Summer?
Oh, sorry. As we're going through, I'm going to ask Amanda to put that in the chat box of how we manage that process. Can you hear me?
Yeah, I can hear you. I think because I actually know the answer to it, but
Okay,
I
go
don't want to
ahead. Yeah,
disclose
go
it.
ahead, and then I'll.
Oh.
Yeah, go ahead.
Okay,
Sorry.
the answer is that let me look at my chart. My chart is that you all have, I think it's bilateral, but let me just look right. No, it's unilateral. Right, it's right, which would kind of flow from the concept of data sovereignty. Yes, it's a unilateral data sharing agreement where the data is going from the tribe, from the state to the tribe.
Yeah.
Okay, thank you for that. All right, so I hope what people can see on the screen, and someone's going to have to tell me this audibly because I can't see it right now. Does it say please fill out the evaluation, the session evaluation?
Yes, it does.
Yes, it does. Great. Okay, and then here's the QR code. And with that, I want to say, before turning it to Sophie, thank you very much to Megan and Darian and Summer, as this was, I always learn from listening, and I did learn today, and I appreciate that. And I hope that the people who participated, who got to take this all in today, feel the same way. So with that, thank you, Sophie.
Thank you all. I think you said it all, Chris. Thank you to all the presenters, Summer, Darian, Megan, and Chris. Thank you for putting this all together, and we look forward to seeing you all at our next Tribal Public Health Data Modernization Learning Community in the next few months. And please fill out the evaluation. There's also a link to that in the chat, and we'll include session materials and the evaluation in a follow-up email, as well as the recording. Thank you all.
Thank you.